Today I'm speaking with Emma Walke from the University of Sydney, and Emma has just published a paper in Rural and Remote Health titled "Do Dose Administration Aids Support Medication Adherence for Aboriginal and Torres Strait Islander Peoples? An exploration of patients' perspectives, experiences and use of dose administration aids on the North Coast of New South Wales." Welcome, Emma.
Thank you. Thanks, Melissa.
First, I wonder if you could introduce us to the research team involved.
Yeah, for sure. So I was really lucky. I was doing my master's. So this is my master's project. And I was working with Professor Leslie Barclay and Lindy Swain, Dr. Lindy Swain, and Joe Longman. So Joe Longman, who worked really closely with me on this paper.
Fantastic. And how did the study come about?
Well, it's a bit of a long story. So around 2013, the government changed some funding for a program called the ITC program. And that program was specifically to deliver care coordination and support services to Aboriginal and Torres Strait Islander people. But they had some sort of medical aids as a part of that process. And so they added in dose administration aids to the list of items that were available. And at the time, and it's still occurring, but at the time, the QMAX program was in place. And that really was only available to Aboriginal and Torres Strait Islander people who used community-controlled health sector services. And so this ITC program meant that, or the changes meant that people who don't use an ACHO can now get access to paid dose administration aids to help manage their medications. And so, given that we know government rules change and program rules change quite regularly, I felt like it was really important. And this is really not only just based on that, but based on yarns that I'd had with my community and my family, that we wanted to kind of build evidence to show that this was actually really important for this to continue. And so hence the study.
Fantastic. I should ask you, what actually is a dose administration aid?
Yeah, a good question. So when you go to the chemist and you get maybe 3 or 4 different types of medications, that's quite hard to manage. And so what they can do is offer you dose administration aids, and people know them quite well as Webster packs, or most commonly used at the moment are sachet packing. So they've put the right tablets in the packet so that when you wake up in the morning, you know that you have to take these tablets, you know what time you have to take them, etc. So it just helps to be able to manage what you've taken and remember that you did take them.
Right. And so what did you find? Do they work? Do they help?
Yeah, I think the short answer is yes, they do. I think people who use dose administration aids, particularly the people we spoke to or I spoke to, they had really, really complex medication regimes, and being able to use those aids or have those aids really made things a little bit easier.
Right. So what needs to happen next, Emma?
From my perspective, I think we need to just get that information out there. So that's, obviously having a paper out is really, really important. But also, trying to advocate for continuation of these types of fundings with places like NATO and the Pharmacy Guild and the Pharmacy Society to make sure that, people can get access to it. I mean, there's definitely opportunities for wider research because we really only looked at my communities or the communities from the North Coast of New South Wales. And I'm sure, there are other communities where they may not work, but it'd be very interesting to see that.
Yeah,
But I certainly think in terms of the best next steps is just to advocate for that to continue to occur.
fantastic. Oh, that's really great. And thank you so much for talking with me today.
Thanks so much, Melissa, for asking me.